that area's had little or no cases of COVID. Are they able to remove their masks during this heat wave?
The issue with masks, and I understand that we're down to very few active cases, known active cases in regional Victoria. Masks make the difference between a super spreading event and potentially infecting no one at all, or one or two individuals. When you're not wearing a mask, the ability to spread the virus to anyone around you is much, much greater. So that's a setting that we think is really important. Now, we will review it over time. The settings will change as these numbers are driven down. And I'm very confident we've seen every 10 days we've seen a halving of the number of cases of unknown origin. We've seen a halving of the number of active cases. So it's totally heading in the right direction, and the settings should change over time. But right now, the stakes are so high for regional Victoria that if there's a seeding, and there are still people moving into regional Victoria in their hundreds, if not thousands, we need to protect everyone there from the possibility of a cluster that becomes an outbreak, that becomes explosive numbers. That's a really high stakes game.
It's just 3 active cases in regional Victoria at the moment. How long would it need to be at 0 for you to say to regional Victorians, you can take your masks off?
Look, there are both the reflections on the number of active cases. They're the cases that we know about, but we've got ongoing high-risk workers moving into regional Victoria for essential reasons. They are doing the right thing. We have surveillance obligations for them in terms of the testing program that Jerome spoke to the other day, but the risk of reintroduction is still there. So,
because of people leaving Melbourne and going into regional
correct.
Victoria, yeah.
You know, people will continue to leave Melbourne, but we're driving the cases down in Melbourne, so the risk profile in Melbourne is changing week on week. So that will change. The settings will change for masks, but at the moment, as I say, it is so important to have 0 cases ongoing in regional Victoria. I'm sure regional Victorians are as fed up with masks as some of us are, but they are absolutely motivated to be COVID-free.
Just with the active, sorry, I'll stay with Brett. Brett, just with the current active cases, are you tracking how many, putting into your sort of averages, how many are in healthcare and aged care, and sort of separating it out versus wider community?
Yeah, absolutely we are. So we know that, in recent weeks, aged care, healthcare, and it's mostly aged care, make up about 3/4 of our daily cases. So on the one hand, it's a challenge. We know we need to keep an absolute focus on it. We've seen the number of active outbreaks in aged care drop by 20% week on week, so that's going in the right direction. We've seen the number of active cases in aged care come down by 10% almost every day. It remains at about half of our total active cases. So it's coming down as our total active cases are coming down. But it's still a challenge and it still makes up the majority of our cases. So while being of a concern, the reassurance that we have is that our sporadic community cases, those individual cases that we see not linked to those aged care or other outbreaks, are smaller and smaller. They are a small proportion every day.
Does that give you flexibility when we, in 2.5 weeks' time, does that give you flexibility to say, okay, well, the average might be 10, but the average outside of these industries, these sectors, is only 3, therefore we can open up? Is that something that you'll take into account?
Yeah, maybe not so definitively a conclusion as that, but absolutely. That's what we talk about when we talk about the narrative behind these cases, the story behind these cases. And if we are satisfied that there are outbreaks that are contained, where we know all of the links, or aged care transmission that we are happy is contained and under control, then you can almost set those cases aside in your considerations. So that's true. That said, every aged care facility with active outbreaks has staff who work, family members who also have work in essential industries and who will have their own contacts. And so we should never be complacent about the possibility of spread that leaves those settings.